So this first question is about increasing COVID-19 vaccinations in communities of color. Community Service Society issued a report today that found that 36% of Latinx and 31% of Black New Yorkers said that they or a family member had COVID-19. This was versus 20% of white people. As of this week, however, New York City has vaccinated just 5% of the population. So, my first question, what would you do to ramp up vaccine distribution in New York City? And how would you prioritize distribution to communities of color over other groups? Or rather, would you prioritize them in that way? And if so, how would you do that? First up, I'm going to ask Mr. Menchaca.
Thank you. Thank you for inviting us. And my name is Carlos Menchaca. I'm running for mayor. And this question is really important for us to think about. COVID-impacted communities include immigrant, public housing, people of color communities. The one thing that has been a barrier is language access. One of the things that we need to do is to ensure that all the languages are included as we bring good information, solid information, dispelling all the myths. Two, we need to bring massive amounts of vaccines in places like open stadiums. I think that one of the things that is important is that we bring more vaccines out to people. The last thing I think is really, really important is that we work with trusted community partners. Make the Road and others have incredible health programs that have already built solid relationships. As the task force co-chair of the census in the city council, we learned so much from the census program that we can reactivate to ensure that we rebuild infrastructure that is already warm to include good information, motoras, and others to bring vaccines. Thank you.
Thank you. Now I'm going to ask the same question of Dianne Morales.
Thank you. So, you know, I think I really appreciate the opportunity to answer this question, and I appreciate the framing of health, the health of our communities as being intersectional and being connected to so many other social determinants of health and so many other social inequities that actually exist. And it's not surprising that the vaccination rates are actually reflective of that. I think one of the things we have to recognize is that our communities lack trust in the institutions that are supposed to be charged with caring for us. So I think that in addition to some of what Carlos mentioned in terms of the need for us to provide education and information in a linguistically and culturally appropriate way, we also need to engage our credible messengers from the community, not only to provide us information, but also in the distribution and dissemination of the vaccine. And that includes accessing seniors in their homes, mobilizing our faith-based community and local community organizations to support the dissemination, and really making sure that our essential workers are at the forefront and that this information is getting to our low-income people of color communities so that we can actually provide them with the support that they have in turn provided us throughout the course of this last year.
Let me ask you a quick follow-up question to that. As a former nonprofit executive, how does the city, or how do cities get it wrong in working with nonprofit and community-based organizations in these efforts?
How much time do I have? No.
1 minute.
So, you know, I think that one of the things in this particular administration that's been done terribly wrong is the lack of trust in the community-based organizations and the lack of actually letting community-based organizations lead. We are much closer to the problems, much closer to the community, much closer to the solutions. And I think that one of the things that has been sorely missing is the real true partnership and engagement of community-based organizations and sort of following the advice and the recommendations. We have the community's trust. They have come to us for the last 12 months for food when the city has failed, and all sorts of other supports when the city has failed. We have those relationships. We could actually make a difference and make this happen.
Thank you. Thank you. And now I would like to go back and ask General Sutton the question about vaccine distribution.
Sure. Well, I think, first of all, thanks for having me this evening. I think many of the important points have been raised, and I would just reinforce a couple of of them. One, I think this is an all of the above strategy that the city needs to look not only to the community-based organizations, the credible messengers, the houses of worship, the faith communities, the senior centers, but also the private sector. And I think this is where individuals, particularly the essential workers, many of whom, as we know, are immigrants, are people of color, they have to have the trust that this is the right thing to do, and then they have to have the access of being able to actually access the vaccination. And I will tell you, having worked with numerous folks over these last several weeks trying to get appointments to vaccinations, it seems like it's just starting to break open this week, which is a good thing, but it's been an absolute disaster. And so I think that the kinds of issues with trust that Dianne mentioned and that Carlos has mentioned as well is absolutely critical to move forward. Thank you.
Wonderful. Thank you. Mr. Stringer.
Look, we didn't know when the virus arrived, but we knew that the vaccine was coming. And the fact that this administration did not plan for mass distribution is so outrageous to me. It's just terrible. Look, as controller, I told the administration, let's get going. We need 24/7 sites. We need to redirect contact tracers into communities of color and neighborhoods where we have language barrier and language access issues. And we need to do that now. I offered a plan called Fair Shot NYC, demanding that employers give employees paid time off to get that vaccine. And we need data. We need data on race, we need data on zip code, and we need to have a system that breaks down this bureaucracy. Look, the longer we take to vaccinate, we can't open the economy. The longer we take to vaccinate, our parents and grandparents and people with pre-existing health conditions are in danger. I get calls every morning, not from people over 75. I get calls from people who are in their 40s and 50s saying to me, I can't make an appointment on the website. There's 3 separate websites. They're crashing. I can't get my parents and
Thank you, but I actually have a follow-up question for you, Mr. Stringer. With that, I mean, you talk about streamlining vaccine administration. Who would you charge with doing that? And can you provide just a few details?
Yes. Look, in this administration, we have sidelined the Department of Health. All the responsibility rests with H&H. They are overwhelmed. I would put DOH in the front seat of this, but ultimately it's the mayor and it's City Hall. And you got to be able to manage a 2-car funeral. And that is what has plagued the administration, why I'm running for mayor, because I have a progressive agenda for the city, but I also got the skills to manage. And that's what we need right now, because we've got to get people inoculated before more people die.
Thank you. Thank you.
Yeah, let's just start with the fact that communities that have experienced 73 to 88% of the deaths due to COVID should be vaccinated and seen as priorities for vaccination. It's just math, as well as humanitarian and recognizing who's at the greatest risk. And unfortunately, one of the reasons it's communities of color is also because we have had not just pre-existing conditions, it's that we've had inadequate services, equipment, and staffing in facilities in communities of color. So in some instances, inadequate equipment to save lives that otherwise could have been saved. So we absolutely also have to invest in the infrastructure, the services, and the staffing, along with vaccinations, because as we roll it out and as people continue to get sick, which we should be preventing, we have to make sure communities of color are getting the health care they deserve, because it's a human right.
Thank you.
I put out a plan back on the 3rd of January that 15 of my colleagues signed on to, that laid out how do we reach 3 goals. 1, how do we have our high need individuals? 2nd, those communities that were disproportionately impacted by COVID-19. And 3rd, how do we reach herd immunity? We have failed to execute this plan or any plan in real time. I would focus on those communities that were hardest hit during COVID-19. I know them so well because I was among them as I moved throughout the city. But I will also do it in a transparent way. You could have a handheld. Every time you inject someone, it goes into a device, uploads to a mapping system that would show that we're moving steadily towards those communities that were disproportionately impacted. Right now, to date, after repeated calls, we have yet to know who was actually vaccinated and the ethnicities. That is wrong.
Thank you. Thank you. And can you talk a little bit more about this tracking system? Is this a tracking system that is with people who have been vaccinated? And if so, if it is, for instance, an app, how would you ensure equity in that, given that there is a bit of a digital divide?
No, and it's nothing. The individuals who are actually being vaccinated, they don't have anything to do. You walk inside a location, you're vaccinated, the person who issued the vaccine will put the information that we are already collecting. Keep that in mind. You'll put it in a system that's transparent, that will be uploaded to a central database. So we will monitor in real time the zip codes, the ethnicities, the gender. 28% of the vaccines that were issued went to people outside the city of New York. Some did not work in the city of New York. And we have yet to have the accurate data on the ethnicity and the demographics of who received the vaccine. That's unacceptable.
Thank you, Mr. Adams. And now I will ask Mr. Donovan.
Thanks, Sheryl. And I want to agree with Eric that we need better transparency and tracking across racial lines for how the vaccine is being rolled out. It's unforgivable that's happening. But we also have to remember that one of the fundamental problems is we're not getting enough vaccine here in New York City. One of the unique things I bring to this race is my deep relationships with President Biden and Vice President Harris. In fact, the person leading my health policy team is now going to be on the COVID-19 team in the White House for President Biden and Vice President Harris. So we need someone who can make sure we're getting our fair share in New York City of the vaccine and putting it to work quickly. We also have to recognize that what underlies this problem is a much deeper problem in inequities in Black and brown communities in New York. I have a proposal for what I call 15-minute neighborhoods. Every New Yorker, no matter where they live, the color of their skin, what language they speak, should have access to the healthcare they need in their neighborhood. One of the fundamental problems is we don't have the healthcare infrastructure in Black and brown communities that we need. I would fix that long-term problem as well as mayor to make sure that everyone can get vaccinated.
Thank you. Thank you. And if you'll let me follow up, I wanted to ask you, because you were involved in the federal Ebola response with the Obama administration. I guess my question to you is, were there any lessons that you learned, even as budget director, that you would apply toward ramping up the vaccine distribution and making sure that it's equitable in New York?
Absolutely, Sheryl. I appreciate you asking. I was deeply involved, in fact, side by side in the Situation Room with Dr. Fauci, as well as our military leaders, working across West Africa, as well as in the US. One of the lessons we learned, and we set the stage really for the speed of the vaccine development. I think there's even more that we can be doing to not just develop new vaccines, but to make sure that these emerging variants, that we update vaccines quickly. And we need someone in City Hall who can work with our leaders like Dr. Fauci and others to be able to make sure that that happens. A second thing I would say is that fundamentally, we made sure Ebola didn't become a pandemic because we did deploy very, very rapidly testing and tracing capacity in a way that Mayor de Blasio hasn't in this city. That was done by using every single agency that we had available, including our military leadership. That's something that we did not do effectively in New York. Every time any agency touches any New Yorker, we ought to be using that contact and that interaction as a way to make sure that we are doing contact tracing and testing through the latest technology.
Thank you. Ms. Garcia.
Thank you for that question. I put out a plan last week on how we could rapidly ramp up vaccinating our most vulnerable population. So it isn't whoever can get through one of the 3 websites and score a concert ticket like vaccine appointment. We should have been far more thoughtful about how we distributed it. And I have said that I would reserve to 25% of the vaccines for those who are homebound seniors, for those who are people in NYCHA. We need to rely on our community-based organizations who are trusted by seniors to ensure that we are getting vaccines to that population. We should have looked at it through the lens of, would they be able to manage a website form? I think not. I think we should have been calling them to ask them when they could have an appointment. Thank you.
Thank you. I want to ask you a follow-up to that. Since you were leading the city's COVID-19 food distribution and also food supply, can you talk a little bit about how that experience then would inform how you would fix vaccine distribution if mayor?
Absolutely. So different from the vaccine is we didn't know we were going to need a food distribution system until we were hit by the pandemic. And literally almost overnight, I set up a team with technology to distribute what ended up being 130 million meals. You have to leverage everything you have. Taxi drivers were the delivery system. We brought in more folks on tech. The teams at the sites were made up of National Guard, DOT, DEP. You need to throw everything in the kitchen sink at something as important as vaccines and break it into chunks. Where is the supply? How is cold storage being managed? Are you actually solving for the right problem? Are you identifying the most vulnerable and ensuring that they get shots? And how are you tracking it? So as the borough president said, transparency is key as we move through this process.
Thank you. Thank you. And Mr. McGuire.
Yes. Hi.
Hi.
Your question is COVID and the response?
A vaccine, yes. How would you ramp up distribution, but also ensure that is equitably distributed?
So let me start by saying I have invested in healthcare pretty deeply, and I have managed through crises. What did not occur here was responding to that which we knew. And I've written about the systemic inequities in healthcare. We knew the areas of concentration of the highest impact of COVID. And what we should have done from the outset was prioritize those areas. And I've written about how we should not only prioritize, but monitor with data how those areas were being treated. And I would have made certain that the vaccines were prepared and ready on site in those geographies that were the most at risk. We didn't plan for it. We're now on the defense, and many of the people who could have been treated early have now been left with this horrid disease. And we needed to access all of our relationships here to make certain that the COVID was readily available. We know who the healthcare companies are. We know how the transaction was negotiated from the start, and we knew the failures in the system that could have been predicted that eventually came to pass. So we would identify it early.
I do want to ask you a follow-up on that, given your experience in the private sector. Could you talk about how you would ensure that the public and private sector are working together close in hand to ramp up distribution? What are some best practices, things that you've learned that you would apply as mayor?
I know of the best practices in some of the private side where the execution was planned for many days ahead of time and where they followed the protocols of who should get vaccinated first. And not only did they executed to the point where they ran out of the vaccine. So they executed according to plan, to which they'd planned, and they tried to interact with many of the existing facilities and were prepared to lend the services, but those facilities didn't have the appropriate leadership, which starts at the top, which starts with the mayor's office. Inadequately planned for, ineptly executed, which is now still being ineptly executed.
Okay. And how would you do that differently?
I would make certain that the private sector and the practices, and I can't tell you it was perfect. I can tell you that it was well executed, but I would make certain that they could interact with, which they did, with many of the public facilities, but the public facilities didn't have the resources and didn't have the authority to execute on the plans that many of the private hospitals did have the authority and the wherewithal, the resources to execute. So I'd make certain there's better integration, which there was, but I would also make certain that the leadership that didn't occur, that could allow that integration, that the leadership was there. And I would leverage the private sector best practices and the public sector best practices, and I would make certain that they get executed in the geographies with Black and brown people who are the most at risk, who have suffered the most from COVID.
Thank you. Thank you. Mr. Yang.
So many New Yorkers are frustrated right now because we're in the midst of a crisis and we know the vaccine is our pathway out. But the vaccine supply has been insufficient. People are frustrated with, as Kathryn suggested, there are multiple websites and organizations to try and make an appointment. And then the prioritization is unclear. So number one is supply. We are the original epicenter of COVID-19. Pfizer is literally a New York company. And it reminds me of the PPE competition under Trump, where all of the localities were competing for resources and were bidding against each other. New York City needs to have an adequate supply of the vaccine. That's job one. And the mayor should have been working toward that goal continuously until we were sure that we had enough of the vaccine. Number two is our healthcare information system do not talk to each other, which is why Kathryn's right about how fragmented it is. We need to have one intake so that people can know where they can get their vaccine, what's the most convenient location for them. The best resource that exists in that direction right now, I think, is being run by ABC Eyewitness News, which is not what you need if you're going to restore confidence in our government. The third thing is that we should be vaccinating essential workers who are more disproportionately of color.
Thank you. Thank you. I want to ask you a follow-up about that because you have talked about a vaccination passport of sorts and using that. And I wanted to ask you about that, and also ask you how that would, in using that and using technology, you would ensure that is equitably applied, given the fact that there is a digital divide between white and Black and brown and communities of color and low-income communities.
New York City is a place-based economy. We need to be able to convene in schools, in businesses, eventually in restaurants and bars. And so after you get vaccinated, there is something that universally happens. You get a card and it says your name, how, where and when you got vaccinated, whether it was the first dose, the second dose. Everyone gets one of those cards. Now, the goal is to try and add value to this card by, as Eric suggested, actually checking in with a database so that you can have that information confirmed. And if you do have a smartphone, you can just show, it shows green, says you've been vaccinated in a particular time frame, or during this interim period, perhaps that you've gotten a negative test in the last little while. Now, do you need a system where you can also just present that vaccination card and then have someone confirm it manually? Yes. That is lower impact because someone can't confirm it against the database, which the app can do, but everyone gets that card. And eventually we have to get to a point where, to drop your child off at school, for example, you can flash that card, someone looks at it, knows you've been vaccinated, you can enter that school safely.
Thank you.